in the same day. Okay, next we have family history. Refers to a review of significant medical events in the patient's family, such as the health status or cause of death of parents, siblings, and children. Any diseases of family members that relate to the chief complaint of the patient or that place the patient at risk are included in family history. Most of the time family history also related, like heredity, like if the father has any of the disease and it was inherited to the children. So this is also influenced by only the disease is in chief complaint, so related to that, then only you have to just note it down in that. This is the family history. Okay. And history of present illness, a chronological description of the development of the patient's present illness from the first sign or symptom to the present. Included in the family history is a description of the location, quality, severity, duration, timing, context, modifying factors, and associated signs and symptoms. So this is history of present illness. It has the detailed history of the present illness. And next we can go for the place of service. Alright, so place of service can be divided into major two categories, that is inpatient and outpatient, hospital or office. Alright, so in initial you can see that here in inpatient hospital, initial visit you can say 99221 to 99223. So in hospital you can also see that there is a consultation code as well and subsequent. And in outpatient you can see new patient and established patient. Alright, whenever you admitted in the hospital, after a couple of days, after the first day, we can count it as subsequent. And in outpatient, if the new patient has been seen more than once, so he will be called as established patient. So in initial and new patient, we have different visits and different consultations. So for visit, the codes are here mentioned, so just note it down, the codes, and we can go for the next slide. Level of service. It is comprised of three components such as history, physical exam, and medical decision making, that is MDM. Again, these three components are subcategorized further, so we just go into it. So first we'll take the history. First key component is history. It contains chief complaint, history of present illness, review of system ROS, and past family social history, that is also known as PFISH. Okay, so let's see what is history. After evaluating these elements, we can consider level of service like problem focused, expanded problem focused, detailed, and comprehensive. Now according to this four type, problem focused, expanded, program focused, detailed, and comprehensive, these are the levels. Okay, these are the four levels. So by this only we can evaluate the exact procedural code, that is CBD. Okay, next point we have here, physical exam. It is also very similar to the history. In this component we have two main elements, body areas and organ systems to examine. For example, if we examine one body area, that means it's problem focused. If we examine 5 to 7 body areas, organ system, it means it is detailed exam. So let me just show you one table, and in that you can just check out what is history and what is examination, physical examination. So history we have here problem focused, expanded, problem focused, detailed, comprehensive. So in problem focused, if we have only 1 to 3, brief history of present illness, so it is also known as problem focused, then we can confirm, yeah, it is problem focused. And if it is having 1 to 3 brief history of present illness HPI and problem pertinent review of system 1, at least one review of system it consists, so it is known as expanded problem focused. And with the extended HPI and 4 or more HPIs and extended ROS, that is review of system, and it is more than 1 2 to 9 review of systems, and 1 PAFISH, that is pertinent PAFISH, past, family, social, history. So there must be 1 pertinent PAFISH, then it is known as detailed history. Comprehensive. So in comprehensive we have extended HPI, that is 4 or more HPIs, and complete review of system, that is 10 or more, and complete PAFISH, that is 2 or 3. Okay, so this is history. And let's go with the examination, physical examination. Here it is. And in examination there are the 4 similar categories: problem focused, expanded, problem focused, detailed, comprehensive. So in problem focused we have categorized in body areas and organ system. So for problem focused, if we have only one body area and one organ system examination, so it will be problem focused. If we have 2 to 4 with 2 to 7 limited exams, then it is expanded problem focused. If you are going to go for the detailed, so we'll have body area or organ systems will be 5 to 7 and 2 to 7 extended examinations. And for comprehensive, if you are getting organ system or body areas 8 or more than 8 operating system and complete organ operating system exam, so it will be comprehensive. Okay, so let's switch back here. So in this, I explained you. And finally there is MDM. It is a bit different than history and exam. In this component we have straightforward, low complexity, moderate complexity, high complexity. Let me explain you again with the table. It will be a bit easy. So in medical decision making refers to the complexity of establishing a diagnosis and or selecting a management option to be determined by considering the following. First, the number of possible diagnoses and or the number of management options that must be considered. Number 2, the amount and complexity of medical records, diagnostic tests, and or other information that must be obtained, reviewed, and analyzed. And point 3, the risk of significant complications, morbidity, and or mortality, as well as comorbidities associated with the patient's presenting problems, the diagnostic procedure or procedures, and or the possible management options. The following chart illustrates the elements required for each level of medical decision making. Below the chart is a discussion definition of each of the elements, the quality for a given type of decision making. 2 of 3 elements are in the table must be either met or exceeded. Just remember this, guys. 2 or 3 elements should be met or exceeded. Let's see the table then. Okay, here is the table. So we have number of diagnosis and management options, amount and or complexity of the data to be reviewed, risk of complication, type of decision making. So here are the four categories actually. So for the first, minimal. If the number diagnosis is minimal, then we will select minimal. Amount or complexity of data to be reviewed, minimal. Okay, and risk complication is minimal, then it would be straightforward. If there is limited number of diagnoses, limited amount or complexity, risk of risk of complications are low, so it would be low complexity. Then we have multiple number of diagnoses, moderate amount and complexity data to be reviewed, and moderate risk of complications, then it would be moderate complexity. Likewise, in number of diagnoses, there are extensive number of diagnoses and extensive complexity of data to be reviewed and high risk of complications, then it would be high complexity. So just like that. So we will not go in more detail in this, because for the CPC especially, we should just remember this table. That's it. Okay, I'll explain you later if it is required. Let's go ahead and get one example. Okay, here we have example. Today Dr. Nick documented a detailed exam and decision making. In the questions, most of the time you don't have to identify if it is a detail or decision, MDM, and the examinations, most of the time in the questions they usually give it right away that it is a detailed exam and it is a moderate complexity decision making, and it is the history. Yeah, the history is problem focused and so on. So let's see here. We have today Dr. Nick documented a detailed exam, and detailed exam, you just note it down here, detailed exam and decision making of moderate complexity after patient's last visit in 4 months. Okay, so how can we solve this answer? So let's go for the tips. What should we know about the question? So we should know that place of service. Okay, and the patient is new or established. So first of all, place of service. So patient's last visit in 4 months. Okay, so here you can understand that the patient has been visited to Dr. Nick no past 4 months, 4 months back. So the patient is established patient. And second thing is, anywhere it has not been mentioned that the patient is admitted, so it is not hospital, it is not inpatient, it is outpatient. Okay, so it would consider as office. So first 2 points are place of service. Place of service is outpatient, office. And second point is new or established, as the patient has seen within 3 years, so the patient is established. And third point is level of service, and fourth point is check the codes. So third point is level of service. So how can we identify the level of service? The level of service here, it is written that the examination here, the physical examination, also in short written as exam. That's it. So it's a detailed exam. If you remember the table I have shown you here, the detail. Okay, the examination is detailed examination. Okay, so likewise, and decision making, it is MDM, medical decision making. So decision making of moderate complexity means MDM is moderate complexity and exam is detailed. Let's go for the code then. As we came to know that it is an established patient, so if you remember,